My name is Greveson. I'm inflammatory bowel disease nurse at the Royal Free in London. My development in social media, I guess, has been gradual. So I started tweeting just a few little bits at conferences previously. But I think it's essential just to get the message out there to people that maybe can't attend the conference, patients as well, that wouldn't get the option to attend a medical conference like this. And I think it's good to convey the research that's been done and just the latest innovations really, and to share with colleagues. It's also good for networking because I find that there's increasing numbers of people are using Twitter, but there seems to be like a little network of people that tweet all the time, and so it's good for communicating that way and just getting new connections and kind of establishing networks. I think the key points is that, as they said, there's a IT revolution really, that there is a lot of new developments and a lot of new innovations that are changing IBD, and that it's essential to involve patients in that. But it's also essential to kind of work with your IT departments, because it seems to be a bit of a reluctance from healthcare professionals based on IT, based on the fact that they might feel that they're stretched already in the service. So as Stuart said, they've got to kind of buy into it really, and they've got to buy into the concept of investing time to input the data, because they've got to know that they're getting something worthwhile out of it. And I think you are getting something worthwhile out of it from the enhanced communication with patients, through giving them a bit more ownership on the health and involving them. And it's almost like a partnership, and it enhances that partnership really, all the kind of digital and innovations that are being developed. The IBD portal, for example, you've got a link to a traffic light system where patients can put in their symptoms, and it'll tell them whether they need to contact the IBD nurse, and it'll also let the IBD nurse know whether they need to contact the patient who's been flagged up. But it also gives information that links to Crohn's and Colitis UK and links to other agencies that maybe the patient wouldn't be aware of. I think it improves awareness and knowledge, and I think that is shown in clinical studies that if a patient's empowered, then they're more likely to manage their own health, and as a result of that, have better health outcomes.
What would it be?
Well, I think as IBD nurses, we're always good at engaging with patients anyway, but I think it's important to engage with patients, but engage with the wider community and think outside the box and embrace digital health and e-health and all the new technologies that are available.